Hello, folks. Welcome in. It is so great to have y'all here today. We are going to get started in just a moment as we have a couple others trickling in and joining us, but thank you for being here. Alrighty. Well, we may have some others join as we go, but we are at 12 and we want to get started so we can have all the time necessary for our great presentation today. Just a little bit of introduction before we get started and some housekeeping items. My name is Jacqueline Cook. I am an advisor with Trepwise. We're a New Orleans-based strategy consulting firm. And we've been working with the Whole Health Louisiana team and initiative for the last number of years. So we're really excited that y'all are joining us here today. If any of you have not been to a lunch and learn through this series already, or if you aren't familiar with Whole Health Louisiana, Whole Health is Louisiana's cross-sector initiative to address, mitigate, and prevent childhood adversity and trauma within our own systems of care and support. Whole Health Louisiana is supported by the Louisiana Department of Health as our public sector anchor. And Trepwise, the company that I am with, and you'll see my colleague Jordan on screen as well, is the Whole Health Louisiana statewide implementation lead for the next 3 years of our statewide plan. So Whole Health operates following a statewide plan that is focused on four key priority areas. Those are collaboration, awareness, support for the workforce, and prevention and healing. Really, so we can get to the point where we have a state where our children and our families and generally our community members are more supported. They are able to be healthy and thriving no matter where they live or who they are. So this Lunch and Learn, as well as the entire Lunch and Learn series, is really a part of this plan. We are really here to help connect folks like you to learnings from our industry professionals, from our subject matter experts, to again help raise awareness about how important the work is that we're doing and deepen the conversation around trauma-informed care practices. So if you like our webinar today, you can find the full schedule for our fall series on the Eventbrite page where you registered. A couple additional housekeeping things before we jump in. I know many of you may be looking for continuing education credits out of today's session. Please remember, in order to get your credit, you will have to complete a post-session survey. It's pretty quick. We'll drop the link in at the end of the session. We are offering credit for nursing, social work, and licensed professional counseling. So make sure you fill that out so you can get your credit. We are also going to have a Q&A portion after our presentation piece of today's session. You are welcome to submit your questions as we're going through. So you don't need to wait till the end. Me and my colleague Jordan will keep an eye on the questions as they go through, and we will focus the last 15 minutes or so on getting those answered. Lastly, this webinar is being recorded. So if you have colleagues or friends who weren't able to make it today, or folks you think would be interested after kind of going through and learning about this topic, you will be able to share it out with others. This will be posted on the Bureau of Family Health YouTube page. All right, so without further ado, I will go ahead and introduce our speaker. We are so excited to have with us here today, Toni Bankston. She's actually one of our guiding members for the Whole Health Louisiana initiative, and she has just been absolutely instrumental in her work with us and her work generally in mental health care and trauma response. So Toni is the Associate Clinical Director and a member of the Center for Mind-Body Medicine faculty and supervision team. She's been in the field for 35 years. She is the founder and director of Mind Body Baton Rouge. So she's really been bringing services here to Louisiana. She's also a master adverse childhood experiences trainer for our state and has served on the governor's Children's Cabinet Advisory Board and Board for Human Trafficking. So Toni is not without expertise. We are so excited to have her here and hear about her presentation today. And with that, I will toss it over to her to get started. And Tony, we have you on mute.
Unmute. There we go. I always make a little joke about the mute button, and seems like sometimes when I need to have the mute button, I don't. And when I don't need it, it's on. It's just a daily challenge for me. And that's also a symbolic reference as well. I want to welcome everyone. I want to thank Jackie and Jordan because they have just been so supportive and given me the reminders and the structure that I needed. I also want to, thank Dr. Christine as well. You've just been so wonderfully inviting for me to do this. I'm a licensed clinical social worker. Those of you who know me know that. And I do work with the Center for Mind Body Medicine, and it's a company that I've worked with sometimes sort of as a side gig, doing lots of trainings here in the United States and internationally where there is stress and trauma, war, climate disaster, you name it. We've sort of been there and done that. We just actually left Ukraine for, I believe, like our third installment of training, and I'm constantly going other places. What I love about today is that I get a chance to really work with people in my own backyard, my own home. I'm a native Louisianian, and there's nothing I'm more passionate about than helping Baton Rouge and Louisiana heal. When I convinced Center for Mind Body Medicine years ago to really put us in their target sites, because there are many places that the Center for Mind Body Medicine can go here and abroad. Basically, what I said is that there's such an intersection in Louisiana to do the work of our mission. There are many challenges, and many of those are really heartbreaking, particularly when it comes to children. But at the same time, there is a generosity of spirit. There is a community culture and fabric that is extremely diverse. We are walking through, and I believe that a lot of the work that we do on many of the challenges in this country, we have a blueprint for working those because we've been living them for many generations. So again, it's just an honor for me to be here today to talk to you about retention, resilience, and recovery. We'll be focusing a lot on, what are those things? What are the challenges in remaining resilient, both as a provider from the individual perspective, but also from the organizational lens. So my hope today is to kind of look at both of those implementations or applications, organizational and leadership, and then also every person, whether you're a clinician or whether you are a prevention specialist or you're a parent even, anyone can benefit from this information. And I hope to cover those areas. And just bear with me if you notice that I'm going through some slides a little more quickly, it's because I do tend to over prepare. And so some of these things are really worthy of a workshop all on their own. And so I'm going to try to cover it the best that I can in the time that we have today. And again, I'm open to your questions. And thank you so much in advance for being an attentive and listening audience. What I'd like to invite you to do really as kind of a real life, real time example of one of the most simple ways that we can take care of ourselves in this work is to just take some breaths with me. We have a practice with the Center for Mind Body Medicine. Our approach, by the way, is really bringing simple and powerful self-care skills that are known to alleviate stress in the mind and body and build resiliency. And it's primarily through a supportive group approach. However, these methods are its methods and the lens through which we operate can be provided at any level of care, whether it's individual with yourself or with your collective community-wide approaches, and also groups. So this skill I'm going to invite you to do with me is just one simple example of how you can bring self-care into your workplace in a very time-limited way if all you have is 5 minutes or even 3 minutes. So just allow yourself to sit comfortably in a chair. First step is really letting go of anything that might distract you as best as possible. Devices down, papers down, hands in your lap. I often ask people to notice how they feel when their hands aren't having to be busy doing something. And just allow your attention to focus on your breath for the next couple of moments, guided by my voice. The simple act of slowing down and deepening your breath, the evidence tells us across the board that it has lots of healing components. So just noticing your breath and being intentional about slowing it down. Allow your shoulders to be a little more loose. Breathing in through your nose and letting a long exhale come out through your mouth. And noticing the location of your breath. Stress breath really is happening a lot at the top in our chest, or sometimes we might notice that we're not even really breathing. We might be pausing our breath. And just allow that breath to travel down more to the abdomen, which is where relaxed breathing happens. It's like a direct communication with our nervous system through this process. Allow your belly, you'll notice it expanding on your in-breath and relaxing on the out-breath and softening. And again, this very simple tool, which we use with children and adults alike, is a very simple but powerful way to let ourselves understand that we're safe in this moment, or that we can be in peace at this moment, regardless of what is going around us. Sending oxygen to all parts of the body, including the cells. We can enhance this process by saying the word soft as we breathe in, and belly as we breathe out. So take a couple of moments without my voice just to breathe this way, letting thoughts that might be coming into your mind about other stuff, letting that come and go, bringing your awareness back to your breath. And then bring your focus slowly and gently back to this conversation. This is just a short lunch and learn, so we don't have time really for a wide group sharing, but I would invite you maybe to note what you're seeing in yourself just in those few moments, to note that in the comments. If you're able, it might be that they're not available till the end, but just write it down on a piece of paper. What do you notice in yourself from before and after just taking the few simple breaths? Later on, I'll be talking a little bit more about the other tools of the Mind Body Medicine Toolkit that's been around since the 90s. So we're celebrating our 35th anniversary this year. And I'm going to talk a little bit more about the topic area first, but know that I'll be coming back to explain a little bit more about how this holistic health approach works, and some of the tools of our model, for those of you who want to know more. And then, of course, there's the website, www.cmbm.org. And I do believe I have a QR code at the end of this presentation that you can use to look at our research. So this topic of retention, resilience, and recovery, why does it matter? Why is this something that was chosen to focus on? And I often begin by saying that, bearing witness to the experiences of others, whether it's in healthcare, trauma response, disaster response, or maybe a neighbor who's tending to the grief and loss of a neighbor. It's a wonderful, beautiful experience. It's the best gift that we can give another human being, in my opinion. I'm currently bearing witness to the grief of my grandchildren who lost their father suddenly last December. at the age of 32. Died suddenly of natural causes, heart attack, unknown history of heart issues in the family. And even though I've bared witness to many children's trauma, including my time that I spent at the Children's Advocacy Center as its director, none of those experiences quite equal bearing witness to the trauma of my own grandchildren. And it's been honestly, it's been heartbreaking. And at the same time, it's been my greatest teacher. It's brought another level of awareness and understanding to this process. And there are moments of wonder. There are actually moments in this process that are beautiful. Our patients, our clients, our children, our grandchildren, they really inspire us. And there's a wonder sometimes to watching people's process and see how they heal. And that's a big part of why we do what we do, because I'm getting chills talking about it right now. It's a wonderful thing. And at the same time, what we always want to hold and be mindfully aware of is that there can be a cost as well. So there's a cost and a wonder to bearing witness to the suffering of others. And I have a couple of bullets here listed on the slide in front of you, things that are well known to everyone on this call: burnout, the exposure to trauma, which we know now really has kind of a contagious quality to it, even if you don't have experience of trauma in your past. If you're fortunate enough for that to be the reality, there is a contagious quality that it tends to have. And unlike when we do mission work in other countries where we get, a shot or a pill to ward off things like malaria or cholera, with vicarious trauma, there is no pill, there is no shot, right? The antidote is really self-care. And the prevention is self-awareness, really always being in touch with what's happening with us, not only what's happening in front of us, but what is happening around us and inside of us. That's really the piece that's so critical to being well, remaining well in this work, as well as maintaining the joy that brought us here in the first place. A couple of the bullets that you're seeing on the screen, actually, many of them are cited in the literature, but actually the ones that I focused on for today's talk, are actually data that we hear from the field of people that we work with throughout this country and internationally. It's pretty incredible whenever you get the experience to travel everywhere. You start noticing themes. Even when I was in Gaza, it was like some of the things we were hearing people say about the children and their symptoms of being in a war zone really mimic the symptoms that I was hearing being reported with children exposed to violence in Baton Rouge. The teachers in the schools, the principals, regardless of what state they're living in or what district they're working in, they're telling us some of the same things. That there is an incredible issue and challenge of turnover in the staff. That trauma is being seen in students in schools, for example, at a level that has never been seen before. We know that this is true. We know that suspensions are at an all-time high. And we also notice in schools, won't get off on a tangent about schools, but we also know that the problems that are showing up in schools are happening earlier and earlier. So principals are equally concerned about kids in pre-K 4 and the problems that are showing up there as they are for kids that are high schoolers, where it used to be that was where the biggest reporting was happening. Some of the data you're seeing here are some of the examples of stories that we're hearing are we worked in an entire hospital system, Eskenazi Hospital in Indiana. We had a period of focus studies and group meetings with Brigham Women's Hospital, where we were trying to work on developing a training program with them. And every training program, though it has the same structure, it's very tailorized because every community is different. But the things we heard about were that particularly after COVID, and this is true also with the VA, and again, our conversations with schools and colleges, is that, there was sort of a feeling after COVID in particular where people felt isolated. They felt, as healthcare professionals, they felt isolated. They sort of felt like they were out on this limb, providing this care, putting themselves at great risk, and not feeling connected to a greater system. And also not feeling that enough attention was being taken to preserve their own well-being. And so that really left people with an erosion of trust in systems. And so this is something that we're still hearing about the after effect of what happened with COVID. So let's talk a little deeper about what actually is happening in these systems. Let's see what we can learn about just understanding what's happening and what's going on. And there are many things that are going on, but this is how I decided to really kind of structure a description of something. By the way, the picture here you're seeing is from a training that we did in Ukraine a couple of years back, and they're actually practicing sunflower meditation, which is one we do a lot with kids, but their country flower is the sunflower. So we were leading one of our training sessions with this meditation. So first point about what's happening with the stress and the trauma that goes on in the work environment is that, like all stress and trauma, this is a nervous system experience, isn't it? Whenever we experience stress or trauma, it's not something that we just feel in our mind or think about. It's something that affects our brains. It involves our histories. It involves our bodies. I often say a lot when I teach that stress and trauma are whole body experience. And this includes workplace stress. Some examples of how that might show up is you see team members trying to fix or micromanage. Well, perhaps that is the nervous system operating because this person has learned this way of coping with past trauma by a way of being hyper vigilant to problems or seeing problems before they even happen. It's a way that someone has learned to manage their anxiety, and they're bringing that template or that sort of rapid response way of interacting with the world to the workplace. And it's important in order to respond to people and to help bring a recovery program for them, or to help build a program that encourages retention. We have to understand the roots of things that happen with people. Other examples, people who are silent in meetings all the time, avoiding kind of with collaboration or with seeming to withdraw from other team members. That again could be a team member stuck in a trauma response. Perhaps this is how they learn to cope with stress and trauma in their early days, in their younger years. They learn to go quiet because that's how they had the least impact or harm done to them. We see employees overreacting to feedback. That can sometimes be a fight reaction, like the fight, flight, or freeze response. It can be people getting really defensive because not only are they feeling what's happening in the moment, but it's triggering something back to earlier days with authority figures with whom they didn't have great experiences. People bring these templates of relationships to the workplace. So we have to understand that. Sometimes we see high performing professionals going and producing, and then suddenly burning out or disengaging. Again, that can be another way that people have learned to cope, is to overperform, to overdo, to make sure everything is okay. So there's peace at any cost. But ultimately, no one can continue to perform at that level, and eventually they will burn out or disengage. So I could go on and on about the examples, but those are some of the ways that we see the nervous system sort of, being brought into the workplace as a whole body response to trauma and stress. Trauma. So we know that, especially many of us in Louisiana, many of us, this collective right now that's meeting today, the whole idea is that we want to make our spaces more trauma informed and more trauma specific. So trauma is there in the workplace, and trauma informed places respect that they have to make a place that is safe, psychologically safe, physically safe, but there has to be room there for people to be able to regulate themselves. And the environment there is layered. It's built for this. And it understands that there's many layers. There's social, there's cultural, and organization, not just how the building is built, but all of those things inside. Again, as I said earlier, individuals are bathed in the environment, and the research shows that it has a profound impact on inflammation, stress response, immune function, and trauma-aware and informed cultural organizational designs helps trauma community members like us and those that are working with people in crisis and dealing with stress and illness be more present, be more embodied, as we say, be more self-aware, and that is encouraged. And including that emotional awareness and expression in the workplace, that will help improve, heal, and transform people toward a greater well-being. We also have to challenge cultural patterns in our institutions that can cause harm, like perfectionism, urgency, everything is urgent, power hoarding. These are patterns that stand in direct conflict of the heart of what trauma-informed care is supposed to be, which is really about safety, collaboration, and very important, peer support. I want to share this quote with you. Let me move this out of the way. From Danny Eagleton. She says, if we want organizations that are truly healing and equitable, this work must be part of the conversation. So there has to be transparency, and there has to be a culture created which welcomes people to bring their challenges. And before we leave this issue of trauma, I think it's important to say that adversity happens to everyone. Adversity, even with our kids, can be a good thing. It can help us to grow and adapt. And sometimes we see that getting lumped into the label of trauma inappropriately. But another talk, another day, but there are elements that have to be in place in order for adversity to end up being something that is a growth experience as opposed to a traumatic event. I wanted to include just a word about moral injury because I think it sort of stands on its own. It's apart from PTSD, it's apart from vicarious trauma. It's its own special deal, and it's something that people in healthcare often encounter or experience, particularly when you're working in law enforcement. I know when I worked with child abuse, this happened a lot because there's so much that you as an individual, or even if you're a leader of an organization, as I was, there are so many things that are out of your control, and you may know in your heart that this thing happened to this kid, but right now we don't have all the evidence lined up to make this child safe. And therefore, decisions are made that a child has to go somewhere or be somewhere that you feel really torn about. In fact, your conscience is going to bother you. You might lose sleep at night. This is an example of moral injury, which basically is saying that there's a violation of conscience and trust, and it leads to feelings of shame and anger. It's when we are either witnessing something at work or we are a part of something that's in direct conflict with our own moral compass and our own beliefs or our own ethics. So that's really its own issue. And then there's vicarious trauma. I've already said a little bit about how it has has kind of a contagious nature to it, but without ways to reset the trauma that we're exposed to, or ways we were talking about reset earlier, Jordan and Jacqueline and I, that just having time away is an important way to reset. But we also need day-to-day ways to reset, whether that's having peer discussion, being very aware, acutely aware, journaling, taking time for yourself, documentation. We have to stay on top of that. It's something that we actively have to act and guard against and not just hope for the best about. There are active practices that we can do to mitigate vicarious trauma in the workplace. I'm going to give you a little model in a minute that I think really outlines this. So I said earlier that stress and trauma in the workplace is a whole body experience. Stress and trauma are just part of our reality. And recovery means that we've provided ways in the workforce to heal and mitigate that whole body experience while making it a safe environment. And making a safe environment is more what we talk about when we talk about retention. What makes people feel like they can stay even when the demand is high and the exposure to stress is high? There are actually things that make that easier. Some examples are the pressures that I talked about with the nurses that we've worked with. Generational differences nowadays in the workplace can be a great source of stress among teams. And so there's got to be a way to bridge that. Feelings of isolation. I'm on a team, but I'm feeling sort of like not a balance between the task I have at hand and the support I need to be successful. Those are all examples, and you can see this graphic here that kind of divides it up into the 4 different areas. This graphic illustration I've had for a really long time. I really love it because it kind of, I don't know, it's something clicked for me when I saw this graphic that really kind of named what my own experience was. Because by the time I saw this, I had been to many places. I had been interrogated at borders, between countries, trying to get in one country and out of the other because of my work. I mean, there's just a number of, I've been in places where there was active bombing going on. And those are the more dramatic things. But there's also the day-to-day things of like listening to the stories of children. And so when I finally got to see this model, it was like, yeah, this really kind of gets it in a nutshell, because there's a number of ways in which we can respond to the trauma exposure that we have in day-to-day work. And that's kind of outlined here. Notice on the left, you see a graph that says change in worldview. Well, when we're exposed to the trauma of others or even our own, it does have this way of changing our worldview. Sometimes it changes our worldview for the better, like it really brings out the hope and the inspiration that we may feel. And at the same time, it can make us have a more bitter worldview. I used to sort of joke about the fact that when I was working in child trauma, that when I take my kids to see Santa Claus, I'd be checking out the Santa Claus, like, I wonder if he went through a background check. And, these were the thoughts that were going on in my mind, which was something that I hadn't experienced 10 years before that. I completely recognized that as a function of my work experience. Then over here on the right, we have the spectrum of responses that are possible when we are exposed to trauma. If you notice in this little negative thing over here, this little negative box, these are all the words that you've heard about interchangeably to describe a negative reaction to trauma work. So that's definitely a possibility. But then there are neutral reactions. And this is where we encounter stress every day, but we have things that mitigate it, support us, give us coping strategies, and help us move through it. And then finally, on the right, we forget to really talk about enough. I think we talk a lot about vicarious trauma, but we don't talk enough about vicarious resilience. And that's where the work that we do with people changes us in a positive way, makes us more human, more alive. In many ways, the work that being in these really difficult situations has helped me to feel more authentic and more connected to people, because I'm not coming to people as a healthcare provider from a top-down mode. So this is kind of what we're striving, where you see where I have the yellow stars. This is where what we want to strive for. And again, recovery and resilience around this, or even should I say resistance, we can actually get to a place of such good care of ourselves and in our structure and our systems that we can even have some resistance to adversity. That's really what we're going for. I want to just briefly cite this one study, the Whitehall studies, which many of you may know about. And this is where this is just for your reference. And it's really kind of outlining some of the things that we know that create the most stress in the workplace for people. I won't read through all of them. You'll have access to this, by the way, at the end of this presentation. But just a few examples where people feel a high demand, yet they have very little control. Think about people that work with kids who've been through abuse. They may do everything that they can to make a good case, and then it goes to court, and the court does not rule the way that they're hoping that would rule for the safety of the child. So, it's a high demand, low control situation, or not having those social networks. Or not having the practices outside of work that balance out some of the things we're experiencing in work. So what our goal is in this situation, if we recognize that stress and trauma in the workplace, like stress and trauma everywhere, is a whole body process, then what we need, and this is what our mission is with Whole Health Louisiana, is we want to bring whole health approaches, not just cognitive approaches. And honestly, it's not just about saying the body keeps the score. It's held in the body. Okay, well, I know this, and I know that my body can have symptoms, but what does that mean? What do I do with that? How do I engage with my body in such a way that it's resiliency building? Just for a moment, I'll talk to you about our organization, CMBM, as an example, because it's the example that I know best. The Center for Mind Body Medicine provides population-wide psychological trauma and resilience, resilience building. It's a comprehensive evidence-based program that really focuses on empowering individuals and whole communities through self-awareness, self-care, and mutual support. It's really not just about, it is a toolkit. We offer a wonderful toolkit to people, young and old, but I often talk about it really more as a lifestyle. It's a mindset. It's really making a shift in the way that we see ourselves as providers and the way that we work with people. It's more about having a partnership with the people that we work with. And we were started in 1991. And since then, we've trained up to, I think it's 8,000 health professionals and communities and first responders worldwide. Briefly, Kosovo, Gaza, Israel, Ukraine, Houston, Haiti. I'll mention later Louisiana, Puerto Rico, many places. And we teach children and adults self-skills, self-care skills. And our primary way of doing this is in a group setting. And that's because one of the facets of this model is that healing occurs in community. So it's not about an individual provider just writing a prescription for someone or doing an intervention. That it's in our DNA, it's in our ancestry, it's part of the human experience to also receive healing from others. And sometimes that comes from hearing another person in a group situation name something that you're struggling with, or hear from the experiences of others. When we do our groups, we say everyone here is a teacher. And we're all here to learn from one another. And that's a big component of our work. These are, again, I could probably do a whole workshop just on this, but these are some of the basic fundamental principles of mind-body medicine. I'll highlight just a few. Self-care, you've kind of heard me talk about that. With kiddos, we're not just talking about self-regulation. We're actually spending a lot of time with our teachers, our therapists, the people that we train, talking about co-regulation or shared regulation. That children don't really have the capacity for self-regulation until they're in their 20s. So it starts with us, the adults. So when we train, we actually are offering people an experience to learn on themselves first. And so the training actually includes self-discovery, self-reflection, really kind of going back and look at the messages that we had in our own young lives and how that shows up today. The idea being that when we show up regulated, when we show up self-aware and present, the kids can borrow from our calm. We're much better able to deal with them in a way that is non-judgmental, and we're less likely to kind of fuel their storm. We're able to help bring that calm. And in fact, FYI, because I'm a kid person, we have a whole training now separate from our beginner and our advanced training. We have another training now we've developed in the last 10 years called the Children's Intensive Training. And this is specifically designed just for people who work with kids. It also includes parents, and we even have a component where we can work with peers themselves to learn how to work with other peers. It's really a beautiful process and includes all of these elements we're talking about today, but in a young person's language in a style that is appealing to them. Let's see, more things, safe space, to kind of talk about what that is. A lot of it is not just about having group guidelines or group agreements, but really welcoming people to bring their authentic selves, because the trainers themselves are learning to get more comfortable with the uncomfortable. And one of the biggest things we're imparting is that we can do difficult things and we can be with uncomfortable experiences, and we can move through it. We're not stuck in it. And it's okay. And also, if we as a community have guidelines of mutual respect and we're showing up and doing our job that we've agreed to do, which is to listen with our whole body and our minds, then what we're doing is we're saying we don't have to agree with everything the other person says. We can actually listen, we can disagree, but we're going to respect the feelings and the thoughts of all. One of the most dramatic examples, I think, of this is our Cancer Guide program that happened quite a few years ago, but it was in Israel, and it involved, we had faculty and participants from our program in Israel, and we had faculty and participants from our program in Gaza. And these two groups of people came together with the common mission to learn the mind-body medicine techniques to help people suffering with cancer. And they were able to, even though they were working on the goal of treating cancer and supporting people with cancer, inevitably what came out when we created the safe space, or they felt safety, their emotions came up, their differences came up. What they learned from that was, though, we can create a place where differences can come out, and we can move through that together, and it can be part of an ongoing discussion. Let's see. I talked about learning from others. Self-awareness is key. This is really an awareness model for a lot of at the heart of what we're doing, self-awareness. And finally, home practice. So a lot of what we share with people is that, like any skill that you learn, any practice in your life, the more you do it, the better it becomes more a part of you. So if I invite you, for example, we have a skill called shaking and dancing, and it's all about engaging the nervous system through the body and doing some shaking and some movement. And it's really about kind of getting to the same goal that maybe a concentrative meditation does, but it really has the added benefit of helping people to get unstuck in cognitive patterns, unstuck in bodily postures, unstuck with trauma that they've retained in their body. And at the beginning, me included, it's pretty awkward. Like, what am I doing at this training? I think I'm at the wrong training. We actually did this at the summit. I think it was last year. But people feel awkward. So it's okay, though. We said that is okay. It's okay that, we don't have to like everything we teach. And the idea is if we give people enough strategies and tools, they're going to find at least 2 or 3 that help them with resilience. And shaking and dancing is a good example, because oftentimes people feel a little weird at first, but then they begin to feel the benefits of it. And then it becomes normalized. So that's an example of home practice, but we do this in every session. And the more you do this, it's just a part of who you are, and you really don't have to think about it. Wanted to just include this wonderful, I am an ACEs trainer, but I really love this slide. I want to just remind us about, how this ACEs wasn't the only study of early childhood adversity, but it was a game changer. And it taught us a lot about recovery and resilience, not just with kiddos, but also with the adult workforce. It taught us that connection and attunement to other people have to be part of the equation when we're talking about helping our colleagues. It helped us to understand that our kiddos were carrying sort of these invisible backpacks into school with them. They show up with behaviors, but if we're really curious and we take a non-judgmental approach, become more like detectives, we can learn what's in those invisible backpacks. That really, it's what kids bring to school. Their templates for expectations about who adults are, how they're going to be treated, and what maybe their rapid response is too whenever they go into the school. And that doesn't always work well for them, because the rapid response patterns that they learned at home to help with stress at home is probably going to work against them in schools. But we have to understand that. And this is what ACEs taught us, to really look at the root causes of these things. It taught us about culture and diversity and ethnicity, that we can't really ever completely understand another person's perspective. But if we adopt a growth mindset instead of a fixing mindset, which is what we've often been trained to do with kids in particular, is we have to fix them, right? But when we have more of a growth mindset, it allows us to be curious. And it also allows us to seek to understand, rather than saying that, making assumptions about culture, making assumptions about history. ACEs highlighted physically safe environments, and also having a process for repairing harm. This is huge. This is huge with young people and adult people. So particularly in Western countries, So no matter how great a relationship is, there are going to be moments of disruption. There are going to be moments where something happens unintentionally or intentionally to hurt another human being. The idea is that we learn how to repair that we have a process in place for repairing that. Peer discussions, check-ins, and we're not afraid to have those hard conversations. It's just a normal part of the human experience. I'm going to move very quickly now. Organizational application. I just wanted to include a piece on culture and climate. There's really kind of two definitions here of culture, because we're talking about the culture in the workplace, but then we're also talking about the element of culture that each individual brings to the workplace, and how we have to understand that those shared beliefs and values and practices shape how people behave, and we have to understand that. One definition that I found, or one quote, is that culture isn't an abstract concept. It's what we tolerate. It's what we repeat. It's what we let slide. This is actually straight out of SAMHSA, and some of these slides are just there for your review later, but these are the benefits of a trauma-informed culture according to SAMHSA. And again, these are additional core concepts around what needs to be present in order for us to have trauma-informed environments at the organizational level. Notice the empowerment and choice is huge. Understanding historical trauma, trustworthiness, transparent leadership. And just to break it down a little bit more, again, it's going back to that growth mindset that I've talked about. More than a bucket of skills, it's really a way of being. It's a lifestyle. It's allowing vulnerability and humanity, and really seeing leaders who are being both strong and solid and also willing to be vulnerable, because that's how we teach and help organizations to become comfortable with things that are very uncomfortable, even painful. And it goes beyond lip services and lip service and DEI programs. It's really getting to the bottom of things and having a rich conversation and a culture of mutual respect. Let's see, safe spaces. I've sort of kind of talked about this already. Number 3, workload and scarcity. I mean, this is a reality, particularly right now, that most nonprofits are dealing with, assisting teams with prioritizing tasks and their energy investment, mindful breathing, taking breaths, self-care. Not expecting employees to be completely on their own with their self-care, but actually providing opportunities within the workspace and even changing policy so that self-care is promoted and encouraged. When you do some of these things, I'm remembering when I was at the CAC and we had my first multidisciplinary team meeting with law enforcement, DA, the ER folks, DCFS. I said, can we start this meeting with breath? And everyone just sort of looked at me because they were ready. They all had their case files. They were ready to dive in. And so it was a little risky for me. And one of the things I would say about that is that, when you're bringing in pioneering modern evidence-based methods for having a healthier workforce, there's going to be opposition. We're human. We're kind of resistant to change. We want to do things the way we've always done them. But that shouldn't stop us. That shouldn't discourage us. I have a colleague in Maryland recently. I traveled to Maryland, and she's been working in Maryland longer than I've been working in Louisiana to bring these methods to our community. And she's finally getting some traction. It's taken like 12 years. And she said, don't ever give up. Sometimes it takes years. And I share that with you because when you encounter this opposition, it needs to be understood that this is going to happen. This is who we are, but you lean into that. You ask the questions about it. And also you learn to go where the openings are. Number 4, bringing people back to their why, not only their personal why of why they're there in the workplace, what brought them to work with kids, but also what is the mission of the organization. This kind of helps us to make better choices in terms of how we prioritize our work. I'm going to talk about cultural humility in just a moment. Wanted to share this slide that was developed by 2 of my colleagues from the Center for Mind Body Medicine. It's again its own workshop, but basically it's sort of telling you what culture is. It's the fact that the uniqueness of every individual experience, with that goes the variability of race, culture, ethnicity, nationality, socioeconomic status. And it's through that, not only in our workplace with our employees, but also with our patients, that it's through that cultural frame that people have their own realities. And that's especially true of trauma. Are you my time management person?
Well, I'm just gonna hop in for a moment. So, first, thank you, Tony, for being here and going through so much of this. I know you are a wealth of knowledge, and I know there's even more you can share. As of right now, we don't have any open questions, so I would encourage folks, if you do have a question you want to get in before the end of this session, please drop it in the Q&A box now. If there's a question that comes to you right at the end, we can always follow up. Tony can be contacted via email and we can share how to do that. So I would say drop those if you have them now, but since we don't have anything open, Tony, I'll let you keep going and I'll let you know if a question comes through.
Thank you so much. Like I said, I knew this may happen, but what I want you to know is this. On this slide here, I was going to talk about some examples of how culture shows up. And then, of course, cultural humility, which is really for us at CMBM, this is really where it's at. It's about, it's about being willing to learn and not make assumptions, and having a partnership with clients. Let me move forward. Because the truth is, how does that connect to resilience and recovery? It changes the role of the provider. And I love this graph. This takes away a lot of our stress because in this way of cultural humility, we are not the authority and the fixers. We do a lot of work with Native American tribes. We do a lot of work with African Americans and other people who have, historical trauma, history of oppression. And it's so important to honor that the patient is not the fixie. In fact, the patient may have a lot of beliefs about, institutions of healthcare from many years of negative experiences. And we have to kind of like sit with that and revise how we look at it. And the provider is more of a guide and the patient is then more empowered. I want to leave you. This is the last piece. We talked organizationally, but these are some individual practices that you can look at in the slides later. These are some of my favorites. Some of them I've actually already talked about, but these are kind of the really great resiliency toolkit for those of us that work with people every day. Finding and reflecting on your why, practicing present moment awareness. I always say what you focus on, you get more of. So when you're noticing that you're really in a place of talking and focusing on the negative, you're going to get more negative. So it's really about having that awareness of not only what's going on in you, but around you. There's 3 levels: the person you're talking to, what's going on in the overall environment, and what's happening in you. Setting boundaries. The simplest way for me to say that is that no is a complete sentence. Time management is a function of boundary setting. And letting go of old kind of archaic ideas that we have. I know I grew up Catholic and there was a lot of focus on service, which was wonderful, but there was this concept of dying to yourself in the favor of service to others. And I've had to kind of rework that for myself, but letting go of those examples. Connection to others. This is medicine for us, y'all. Connection is currency, especially for kids. And I brought this in Ukraine. We talked about sunflowers, that when the sun's not out, they lean into each other for energy. And that's what we as humans have to do because it's a basic part of our wiring. And that means at work, having a buddy system. Who's got your back? Who's going to hold you accountable for your self-care? Practicing gratitude. Psychologists call gratitude a self-transcendent emotion because it lifts us out of the everyday and expands, how we look at things and helps us to get along and with each other better. And it's also appreciating ourselves. So taking a few minutes just to say what you're thankful for. Physical self-care, can't say enough about that. On here are things that we do teach about in Mind Body Medicine. We have a whole topic on mindful eating and nutrition, eating to support stress. How do we eat to help our bodies when we are exposed to stress? Exercise and movement. Here are some really great success stories. Y'all can look at these at the end. I really mainly wanted to bring these there because they have some great quotes. But these are all the places that we've worked in. We have a whole health integrated model that we've done with the VA. They already had a whole health program and they invited Center for Mind Body Medicine By the way, the person on the screen is one of our faculty who worked that program, and he's from New Orleans. It's one of our people here in Louisiana. But we basically integrated our model with theirs, and now this is how they train all of their staff and how they work with their combat veterans. We've been in Gaza for a really long time, and right now our efforts are working with children. We recently I participated in children's training not too long ago on Zoom. Western Maryland, working through in partnership with the community college, we've brought, and 30 community partners, we've brought mind body medicine to an entire school district and getting ready to start with another one to work with children and the teachers who work with them and the counselors. Same thing in Vegas. We have a children's training coming up at the end of this month. And these are some of the partners that we have worked with in Vegas toward that purpose. Haiti, been there for a while, same thing, working with schools, working with adults. And then there was a program in Baton Rouge in Louisiana. This is actually one of my last slides. And these are all the quotes from some of our training participants. And for those of you who may be wondering, we're actually right now actively, our CEO, Randy Mitev, has been coming in quite a bit. And we're looking to get phase 2 of this program and its vision and dream restarted in our own community to as many people as possible. Finally, here's a little summary thing that I wrote. Whole health begins with us. Can't pour from an empty cup. Healthy orgs begin with healthy leaders. Every interaction is an opportunity to create safety, connection, and resilience, and most of all, practice. Thank y'all so much it's a lot of information. I'm around if you have any questions or if this has sparked your interest in anything. tbankston@cmbm.org. Thank you, Jackie.
Thank you so much, Tony. Thank you for being here, for sharing your expertise. I always love coming to these, and I love being reminded of kind of all of those individual practices as someone who is not a direct service provider, not directly working with kids, but really not being able to pour from an empty cup. I know it's something a lot of us have heard, but just keeping in mind all of those practices. It's something I try to do, and I hope something that folks can take away from today. I will say, I know we didn't have a ton of questions come through. I see a thank you. So thank you, Nisha, for joining us. Thank you, everyone, for joining us. I am going to go ahead and quickly share my screen just for those folks who are looking to get their CE credit. We are putting a QR code on the screen. For those who are looking for nursing, social work, or licensed professional counseling credits, please go ahead, scan this QR code. It will take you to the post-session survey. If you're not looking for credit, you can also do the post-session survey, but you won't be able to get credit without completing that. So you can see the QR code or the tiny URL on the screen. We ask that y'all submit that by end of day tomorrow. If you do need an extension, you can go ahead and email us at jordan@trepwise.com. If you need a little bit more time to fill that out, that is fine. Just let us know. We will be aiming to get you your certificates by end of week next week. There is more information about Whole Health Louisiana on our website, linked here on the screen. And there are also a number of additional lunch and learns coming up for our fall series. So if you enjoyed today's conversation, today's presentation, our next talk will be, I want to say, August 13th. It's a Thursday. I might have to double check on that date. We'll send y'all some follow-up, some information, and you can see that on the Eventbrite page where you registered as well. So with that, I will leave this up on the screen in case folks haven't been able to scan it yet, just to make sure all of you get through to that page. Thank you so much for joining. That concludes our presentation for today. Thank you so much, Tony. And if y'all do have additional follow-up questions, reach out to us. We will connect you directly with Tony, and you can learn more about her work and her strategies for resilience. Thank you, everyone. All right, I'm gonna go ahead and stop share. If anyone still needs this, please drop a question in the chat. All righty. Thanks, everyone.
Thank y'all so much. I'm sorry that I went over a little bit, but
Don't apologize. It was great, Tony.
I don't think I
Love
went
having you.
over. I got everything in. It was just
You
really
got it all. Got it all. And we will be sharing those slides so folks can refer back
okay.
to them.
Awesome. Yeah,
Yeah.
that makes me feel a little better about all that information.
Yeah,
So,
everyone can sit with it some more.
exactly. Thank you.
All
Have a
right.
good one.
Thanks, everyone.